Hi everyone. In today's video, I wanted to talk about the three types of tissue that are present within the body, as well as talk about the three types of healing processes that occur whenever a tissue within the body undergoes a wound. Now, firstly, starting off with the three types of tissues, the three types of tissues usually dictate which healing process occurs. The first type of tissue that I want to talk about today is what we call a labile tissue. Now, put simply, a labile tissue is a tissue that has a good proliferative capacity, so meaning that is able to proliferate quite quickly. And the key distinction of a labile tissue compared to other types of tissues is that labile tissues are constantly being recuperated or constantly being renewed and are replaced by the differentiation and essentially division of stem cells. So stem cells are proliferating in the basement membrane, and this allows for the tissue to have a very high turnover. So once again, labile tissues are constantly being renewed, and this is due to stem cells in the basement membrane replicating. So what are some examples of labile tissues in the body? Well, firstly, a quite stereotypical labile tissue, and one of the first tissues that you learn about in med school, is the skin. And as you know, the skin is usually, or sorry, I should say all the time, undergoing replication processes. So that's why when, for example, on your bed, if you look with a UV light or a microscope, you'll see that there are millions and millions of dead skin cells. That's because your skin is constantly undergoing replication processes and allowing for the reversal and replacement of tissues such that there is a constant renewal and essentially cleaning process taking place. Because your skin is exposed to so many different types of bacteria and other toxins every day, it's actually required that it undergoes that turnover to remove those toxins from the body. So examples of labile tissue include the skin. Another tissue that is a labile tissue is hematopoietic tissue. So hematopoietic tissue is tissue that is responsible for the generation of red blood cells and white blood cells. So this tissue is present within the bone marrow. The genitourinary epithelium. So this is once again a type of epithelium like the skin. And this epithelium is a labile tissue because if you think about urine, it's a highly acidic substance. So we need for that tissue to be undergoing constant rounds of replication to replace that tissue which may have been damaged by this acidic environment. Another tract that is present with labile tissue is the gastrointestinal tract. And the only disadvantage I would say about this tissue is that it is quite vulnerable to agents preventing or disrupting cell division. Now, what are some examples of agents that prevent this? Well, chemotherapeutic drugs or drugs that we use in chemotherapy are essentially drugs that prevent cell division in all cells that are rapidly dividing in the body. So the unfortunate adverse effect of chemotherapy is that although it does allow for the destruction of tumor cells, which are cells that are rapidly replicating within the body, at the same time, since the cells of the skin and gastrointestinal tract are also replicating at a very fast rate, those chemotherapeutic drugs impact or kill those cells at the same rate. So that's why in patients who are undergoing chemotherapy, we see side effects such as vomiting and nausea due to destruction of the gastrointestinal epithelium, loss of skin and hair, and dry skin because of an impact on skin thinning as well, and we get immunosuppression. And since hematopoietic tissue is responsible for the generation of immune cells, we get a reduction in those cells. The next type of tissue that I want to talk about is a stable tissue. And stable tissues are similar to labile tissues in that they have a proliferative capacity, but this proliferative capacity is reduced compared to that labile tissue. So stable tissue has a limited and slow capacity, and unlike being constantly renewed when it is essentially staying put, stable tissue is not being constantly renewed. So it has a limited and slow proliferation. So this tissue only proliferates when there is an injury. So these cells are normally being held in G0, the G0 stage of the cell cycle, and they only really proliferate when there is an injury being induced to the tissues. So what are some examples of this tissue? Well, firstly, we see stable tissue, in the liver. We can also see them in the kidneys and in the pancreas. So if any of these organs becomes injured, it can effectively regenerate itself. And the liver is quite a famous example, because if you can excise up to 70% of the liver, and as long as the basement membrane of the liver is still present, then up to 70% of the liver can regrow. And that is why liver transplants and liver excisions are quite successful in terms of if there's a liver cancer or something like that, since that cancer can be effectively excised and the liver can regenerate back to what it normally looked like and what its normal function was as well. The last type of tissue that I want to talk about today is permanent tissue. Now, as the name suggests, permanent tissue is the tissue within the body that has the least amount of proliferative capacity. So permanent tissue is essentially non-proliferative and terminally differentiated. And if you remember about cell division processes, terminally differentiated essentially means that the cells are unable to undergo any more specialization and division, and essentially they're locked into whatever morphology and function that they have right now. So this tissue, as I mentioned before, is non-proliferative and terminally differentiated. So whenever these tissues undergo some sort of injury, there is a very little scope for them to actually allow for any healing to occur. So the regenerative properties of the tissues is not sufficient to replace the lost tissue. And then there is pretty much very low levels of regeneration and proliferation. Now, what are some examples of this tissue? Well, it's quite ironic in that permanent tissue is in fact present in a lot of the organs which are very important to the body. Examples include striated muscle cells, so skeletal muscle, also cardiac muscle, which is present only within the heart, and lastly, also neurons, which are present within the brain. So as you can see, although permanent tissue isn't able to undergo any type of regeneration, it is in fact present in a lot of important areas of the body, which include the heart, skeletal muscle, and in the brain. So if you injure or damage any of these areas, there is pretty much no chance that these areas will ever heal. And that is why acquired brain injuries, myocardial infarctions, and muscle problems due to conditions such as MND are so dangerous, because once you atrophy or damage these organs, there is very little capacity for them to actually regenerate and return to what they might have been originally. So as a quick review, the three types of tissues that we've talked about today are labile tissues, which are constantly being renewed by stem cells within the basement membrane. stable tissues which are not constantly being renewed in that they are in the G0 stage of the cell cycle normally, but when there is an injury, there is a limited and slow proliferation. And finally, we looked at permanent tissues, which are non-proliferative and terminally differentiated and are essentially having no regenerative or proliferative capacity. Now, the next aspects that I want to talk about is the processes of primary, secondary, and tertiary intention. Now, here I've got images of primary and secondary intention, which is denoted in this diagram by first and second intention, but the same thing. And I will talk about tertiary intention on the next slide. So I'm going to be talking about primary intention in reference to this diagram, and I'm going to be giving you a little bit of a timeline denoted by these factors on the side here. So let's firstly start with primary intention, and before we look at the image, let's firstly explore which tissues primary intention actually occurs in. As you can see, with the wound on primary intention, it's very small. So primary intention occurs mainly when the wound is very small and in tissues that have a very high proliferative capacity. So that immediately rules out permanent tissue, which is a tissue that is unable to regenerate to a great extent. In that case, primary intention is mainly seen in labile and stable tissues. So as you can see, labile and stable tissues, as they have a proliferative capacity, can allow for a type of healing where essentially there's no fibrosis. However, special structures within the dermis called dermal appendages remain damaged because these structures, once injured, can never be regenerated in any way. So let's see what happens in the first image. At 24 hours, there is the formation of a scab, which can cover the area of injury, and neutrophils, as you can see in the image, are actually the main cellular infiltrate. And that's the case in any essentially injury process, as neutrophils are what are present most abundantly within the body in terms of immune cells, and because of their abundancy, they are the first cells to go and try to attack microbes that may be entering the body and allow for healing and inflammatory processes to occur. Now, these neutrophils usually have a half-life of, a life of 24 hours, and this can be extended to a few days. So as you can see, they are very much associated with the acute healing process, and other cells are able to take over these cells in the future once these healing processes have started to occur, such that more complex healing processes can actually occur. So 3 to 7 days, what occurs is that the basement membrane closes out with there being contact inhibition from the cells from the opposing sides. So to go through that once again, what that is essentially saying is that the basement membrane, which is this part here, closes out in that in this image there is a clear distinction between the actual wound and the basement membrane. But here, as you can see, there is a pretty much quite a straight border that denotes the basement membrane. And basically, within 3 to 7 days, the basement membrane closes out. And secondly, there is contact inhibition from both sides of the wound. And what that means is that since we have the wound here, from 3 to 7 days, that wound closes out such that there is a continuous barrier form. So say, for example, if this is the skin's natural barrier is maintained once again. Now, from 3 to 7 days, there is also a key process of what we call angiogenesis occurring. And angiogenesis is, as you can see, initially there is only the single blood vessel present here, but now we have many blood vessels and collaterals present. So angiogenesis literally means new growth of blood vessels, because angio relates to blood vessels and genesis means growth. So in this case, angiogenesis occurs, and that further allows for inflammation to decrease, since angiogenesis is now providing the essential nutrients to allow for this process of healing to occur. And now that most of the neutrophils have died out, macrophages are now the main cellular infiltrate. So as you can see in the 3 to 7 days image here, macrophages now take over as the main phagocytes. Now, continuing in from weeks, now that several weeks have been passed since the injury has occurred, contact inhibition has now allowed for the wound to be fully closed, as I mentioned earlier, and fibers of the extracellular matrix go from being in many directions to being organized. So in the 3 to 7 days image, as you can see, there are many cells being present, and the orientation of various fibers within the extracellular matrix is quite disorganized. So in that case, as you can see, there is fibrous union, and the joining together of the fibers of the extracellular matrix now all go in the same direction. And this direction is in the direction of function. And what that means is that, say, for example, if we have a particular tissue that is usually stretched out, then the fibers of the extracellular matrix will always line up in the direction in which motion occurs. So if the extracellular matrix is orientated in a longitudinal manner to where the tissue stretches out, then that is what is appropriate, since the tissue will stretch in this manner, and the extracellular matrix requires tensile strength in that manner as well. So diagrammatically, if the tissue stretches out this way, then the fibers of the extracellular matrix will stretch out that way as well, as opposed to be orientated in this manner. So that's what occurs in primary intention. Now, secondary intention is a more complex and more scar-forming process, and within 24 hours, the similarity that we see is that neutrophils are still present and are the same cellular infiltrate that are occurring within the tissue. Now, the wound margins in this case, as is seen in the diagram, are far away compared to primary intention, and there is the formation of a large clot. So this red area here that we are seeing is actually the formation of a clot, and as you can see, it's much larger in its area compared to the wound that we saw with primary intention. So as you can see, there is going to be a much harder task for the tissue to try and regenerate, since the clot is larger and it has to come closer to itself. Now, since moving on from 24 hours, 3 to 7 days has intense inflammation, abundant granulation, and scarring. So this is quite a busy stage that is occurring. So if we take a step back and look at the image here, well, inflammation is quite evident because we have so many cells present here. Granulation, which is essentially just the physical or the presentation of angiogenesis on the surface of the skin, is occurring, of course, because compared to primary intention, there are much more capillaries and blood vessels present within the dermis, which are trying to regenerate the tissue. And finally, there is scarring occurring as well, which is not really present on the 3 to 7 days picture. But when you look at the weeks picture, we can see that wound contraction is when there is fibrotic tissue being formed, and that fibrotic tissue is pulling the wound to be closer to another, and that can cause for a pulling sort of appearance on the skin when you look at a wound which has undergone wound contraction, and that is essentially evidence that scar formation has occurred. And once again, since granulation is occurring, there is also angiogenesis occurring as well. Now, when we look at the wound contraction stage for the weak scenario, we can also see that those cells that are represented in blue, those are actually what we call myofibroblasts. And myofibroblasts, which I'll just quickly label here as these 3 cells, in addition to the other blue cells, these myofibroblasts are actually specialized fibroblasts that are essentially a cross between fibroblasts and smooth muscle cells. So they have smooth muscle-like properties, which actually allow for the pulling of the wound together. And these are the main cells which actually allow for the wound contraction process to occur. So they allow for the wound to contract or appose or be brought together over months to years. And essentially what happens, and if you've ever got a scar on your skin or a deep cut that has healed over, what happens is that you'll see that there is collagen deposition occurring, and usually where that wound has occurred, the skin in that area is a lighter shade compared to the surrounding skin, and that's due to the collagen. Because there is collagen deposition occurring as opposed to being proper skin, there is an inability of melanocytes to proliferate properly in that area, and now the skin is lighter than usual, and this process is what is called blanching. So the skin is whiter or lighter in that injured area as opposed to the surrounding skin, and this is usually seen in secondary intention. So if we quickly review the processes of primary and secondary intention, we will see that in primary intention, within 24 hours, neutrophils are being present with small clots. 3 to 7 days, there is the proliferation of the basement membrane, along with angiogenesis and the infiltration of macrophages. And finally, in the Weeks scenario, we can see that there is fibrous union, and although the dermal appendages will still be damaged, the epidermis is now fully healed, and there is a proper border being created against the external environment by the skin. In secondary intention, we have a more complex and a slower process occurring. Because the wound is larger, there is going to be a larger clot, but still neutrophils are present. In the 3 to 7 days process, there is granulation, the process of angiogenesis, and now macrophages present. And finally, in the weeks process, there is wound contraction, which is brought about by special cells called myofibroblasts, and these are specialized fibroblasts which have smooth muscle-like properties, and they essentially allow for the contraction of the wound such that the wound edges appose, but at the same time, since fibrotic tissue and collagen is being entered into these cells or into this tissue, there is both blanching occurring when the wound is actually whiter, than the surrounding tissue that is present in that area. And at the same time, because contraction is occurring, there is a process of a loss of function. So now that we've gone through both primary and secondary intention, the last process that I want to go through today is tertiary intention. And although you may believe that, primary intention is simpler than secondary intention and secondary intention is more complex, tertiary intention is not more complex than secondary intention because it is essentially a combination of both primary and secondary intention. So tertiary intention involves both primary and secondary intention with, in this case, secondary intention or secondary healing occurring before primary healing. So the key thing to remember is the processes of secondary and primary intention are still occurring, but secondary intention in the process of tertiary intention occurs before primary intention. So primary intention is nothing special, as opposed to it's just primary and secondary intention occurring maybe at the same time, but usually it is when secondary intention occurs before. So the key thing to remember with primary intention is that since wounds that relate or arise or allow for primary intention to occur are so large, there are special cleaning processes that must occur first to allow for effective healing of that particular wound. So in order to allow for tertiary intention to effectively occur, we must first allow for cleaning of the wound. The wound must be debrided, and it must be kept open for at least 4 to 7 days. And once again, this is a framework, and there is a difference between what different wounds must be kept open at, how much they should be cleaned and debrided. And the classic example of a wound that undergoes primary intention is a burst abdomen. And yes, that is as serious and violent as it's heard. A burst abdomen is essentially when there may be an abdominal obstruction, and that's causing for the buildup of food, which eventually causes, like an infarction, causes for the bursting of the colon or small intestine due to an immense pressure. And in that case, the wound must firstly be cleaned, because we may have feces and other food products that may be causing for a hindrance for the healing of the wound. It must be debrided, meaning that it must be cleaned, and various other other tissues that may be including that area must be removed, and it must be sealed up. In this case, abdominal burst abdomens are not usually kept open, but the actual colon must be joined together, once again, the two functional parts which have not gone ischemia or rupture. And if required, it can be kept open to allow for drainage of fluid, but usually burst abdomens are kept closed. And essentially, after the key process in wounds that we do keep open, after granulation occurs, which I just spelled wrong, so granulation occurs, which is once again the physical presentation of angiogenesis under the surface of the skin. So after granulation occurs, the wound is closed. So in a quick review, we've looked at today stable, labile, and permanent tissues, and the two types of healing that we've looked at so far are primary and secondary intention. Now, tertiary intention is actually a combination of primary and secondary intention, since secondary intention occurs before primary intention. And the key thing to remember with tertiary intention is that we first have to clean, debride, and keep open the wound for at least 4 to 7 days. Some cases don't require that to occur, but when that does occur, after granulation has occurred, which is when there is clear evidence that angiogenesis and the formation of new blood vessels has occurred, the wound is subsequently closed. And that subsequently means that there is effective healing occurring. And there is a certain risk with tertiary intention in that the wound can open after a certain period of time, but that is quite rare, but something to keep in mind. So today, once again, we've explored both tissues and healing processes. I hope that has all made sense today. Thank you very much for watching.